Hello, and can we start by saying that it is an absolute privilege to be here today?
Absolutely. All these amazing women who I'm listening to and thinking, wow.
Yeah, most certainly. So, does anyone know how I use this? So, basically, we are from an organisation called Blind Parents UK. This was started around. Can you just correct this one? Thank you. I'll do a Chris Whitty. Next slide, please. I've been longing to say that for so long. Yeah, so we are an organisation called Blind Parents UK. We grew out of peer support. That is our first and foremost what we're here for. We're mums supporting other mums through Facebook groups, WhatsApp, phone calls. We just want to be a place where parents can be heard, where they can voice their worries, their concerns, anything that's, that they've raised, that they are feeling is going to be someone else, that somewhere along the line, someone else has experienced, we hope.
Or had the same issue and the same discrimination.
Exactly. So we provide practical support. So we provide support around breastfeeding, those early days where things can be quite daunting, around pregnancy, around baby wearing. So carrying your baby in a sling if pushing a buggy is difficult, or we also provide support around the types of buggy that help, because some blind mums prefer to pull a buggy rather than push it because it makes things easier when using a cane or a guide dog. So we provide practical support, and also we want to be a voice for equality for blind parents across the UK. So yeah, next slide. So basically this is just what we're going to do. So we wanted to start with some myths. Now these might seem quite straightforward, but believe me, they are not. There are so many times when basic things are missed or misunderstood. We don't want to talk about the stats, or as I've put in this, or not, because if you Google, well, you'll see. And we also then want to give a brief kind of just our stories about what's happened to us in terms of maternity services, postnatal services. Hatala's got loads of stuff that she is going to tell you, and I've got a little bit too that I'd just like to add in after she's wowed us.
No pressure.
So basically, and then we want to just talk a little bit about what can be improved, because there are so many times where if people just listened, we could tell them what could be made better. And it's so important to feel listened to when you're at your most vulnerable, and we just want to talk about that. And then that's basically it, and then there's just some key messages at the end. So so if we could go on to the next one. So these are just some myths. So Hatala's very kindly written these up for me. So the first one is being blind means you can't see anything at all.
And actually, who thinks that might be true? Oh, you're doing well. It's actually false. Only 4% of people who are registered with a sight impairment have no sight at all. So what that actually means is a lot of visually impaired people, and we will be using language like visually impaired, blind, sight impaired. They all mean the same thing, and different people are comfortable with different words. I prefer blind. Becky?
I just say partially sighted. Yeah. It's easier.
Yes.
That's what it is.
Sometimes it's easier to say blind because people understand that, and we'll talk about that a bit later on. So yes, only 4% of people who are registered with a sight impairment have no sight, and there is no pressure to be registered. So some people don't. There is no card that you have to carry to say, yes, I'm officially registered. Let's go to the next one.
Yeah, so the next one is blind people struggle to use forms of technology.
Again, what do you think? Guys, shout out, because I can't see you. So, yeah. False. Perfect. Absolutely false. My house is full of gadgets. An example, today I got a piece of junk mail. I used my phone to scan it. Then my daughter needed some Calpol, so I got my phone to scan to find the right bottle, because helpfully pharmacists put labels over the braille. Unhelpful. But blind people use technology all the time for a lot of things. And, you know, I used to work with a lot of visually impaired people who perhaps have lost their sight in later life. So let's not assume that everybody does, but most people do.
So yeah, so the next one is you need to speak in a loud voice when talking to someone who's blind.
You would be surprised. Most people who are visually impaired do not have anything wrong with their ears. Thank God, because it can be a bit tricky. You know, the amount of time somebody has spoken to me in a healthcare setting. My name is... Hello. But no, you don't need to speak louder. It's fine.
And the next one is people who are blind can always recognize you. If you've met them once before, they can automatically recognize you by your voice.
Yes, absolutely. It's not true. I'm terrible. I will not remember you. Please say who you are. Possibly because my toddler doesn't sleep at the moment, and I've had 2 hours sleep for about 9 years. But so no, it's not true. And some people might do, some people might be very good, but not everybody. So like if you ever meet somebody and you've met them before, just introduce yourself. It saves embarrassment, and it also makes everyone feel a bit more comfortable.
And finally, we have superhuman senses, smell, mostly hearing, I don't know, taste, whatever,
Taste.
Maybe, to compensate for our lack of vision.
Yes, it's not true. But I mean, honestly, every single day I speak to people, and I'm traveling on the underground, and you must have amazing hearing. No, I really don't. In fact, I've probably ruined it from clubbing when I was at, in university. But no, I mean, we probably visually impaired people use their senses in a different way, but it's definitely not superhuman.
Yeah, and next one. So this is kind of the myth that we want to expel today, more so than any other, is that blind people can't be parents. So this is really, really prominent within society. More, there are so many misconceptions around blind parents, why we have children, and we have children to be our carers, or we have children we have children to look after us, we have children because sorry, I've completely, so we so yeah, so we have children to look after us. We can't look after our children on our own. We don't know when our children are ill, so we don't know what they want. So when they cry, we don't know if they're hungry or if they're they're wet, or we don't know the basic things around how to be a parent
and take care of our children safely.
Yeah, we can't be safe on our own. We can't raise functioning children. So this is, if you could do the next one, that'd be great. So yeah, this is totally not the truth. We might need some extra support. Most people are quite capable of asking for what support they need. We know ourselves best. We know our strengths and limitations. But we can raise empathetic, well-rounded, well-adjusted children who sometimes have more of an awareness of disability, of diversity, than, dare I say it, other people's children. We passionately believe that we should be afforded equal rights to be parents.
Respect and respect.
Yeah, exactly.
I think that's the most important. We as visually impaired parents must be, should always be respected to know and understand our children and our ways of parenting.
Yeah. Okay, so next slide. So the statistics, or lack of statistics.
It's your Chris Whitty bit, isn't it?
It is. I don't have any graphs because there are no stats. So if you Google blind parents, UK, or blind parents in general, you get loads of info about how to support a visually impaired child if you are a parent, which is great. If you're a sighted parent of a visually impaired child, that's fantastic.
But there is no support to support a visually impaired child as a visually impaired parent.
No, none of the, not that I want to badmouth any national blind or visually impaired support organisation, but there is no support, hence why we exist. We were there to fill a gap, and a very big gap there was. If you Google blind parents, you get questions like, can a blind person be a parent? Or, as noted there, how do you deal with someone with a visual impairment? I wasn't aware that we needed dealing with, but apparently we do. So yeah, we just felt, like I say over there, we just felt that this lack of statistics was really important to show in itself, because it shows the level of research just isn't there. You know, we're no one's joining up the dots for blind parents either. So each individual couple or person may access maternity services, but no one is doing any research to join up those dots and say, right, how can we help and support these people to raise a family in the most the best way possible, and, work to support them holistically rather than separate little dots.
And how do we support the maternity process? How do we ensure that visually impaired women have a safe, successful, comfortable pregnancy? Because it isn't happening.
Next slide. So this is a bit of just free flow. So Hatala's going to explain her story and her experience.
So I have 3 children, and if everybody can cast their minds back to 2012, and it was an amazing year. We had the Olympics, it was brilliant, and I also found out that I was pregnant. The first hurdle came when I thought, I might be pregnant, and I just married my husband. We were trying, we wanted to have a baby. How do we access a pregnancy test? How can you access a pregnancy test privately if you can't see? Doesn't happen. Still doesn't happen. I had to ask my mother to read my pregnancy test. It's the most awkward thing I've ever had to do. My mum I've got an Indian parent, and my mum's Indian. And I said, Mum, I need to have a look at something. What did you say? Mum, I need you to have a look at something. What? Come in here. What do you want? What do you want? I think I might be. Oh no. What is that? Oh no. Like this, we're married. What did you think happens here? And no, so she told me I was pregnant. I wanted to be the first person that ever found out that I was pregnant, and that was taken away from me. So that's the first thing we had to deal with. Anyway, that was that. And as a blind person, there are certain things you kind of have to just get on with and get over, because if you dwelt on it, life would be very difficult. So you just get on with it. And I got to about 6 weeks and I started bleeding. And when you start bleeding, you're pregnant, there's only one thing your mind goes to, right? Miscarriage. I'm the kind of person that reads up on everything. My husband's like, oh God, you're on the internet again, stop Dr. Googling everything. But I was like, no, we need to go to the early pregnancy unit. We went to the one here at St Thomas's, and they're brilliant. I cannot fault them. Anyway, I had a scan. The first question they asked me was, how do you know you're bleeding? I was like, what do you want me to tell you? I tasted it? What would you want me to say?
It's that improved sense of taste.
Yeah, I heard it. Yeah. Sorry. That was the first question. Anyway, everything was fine, and I booked in with my midwife, with an NHS midwife. And what happened then was extraordinary. So I walked in with my husband. Both of us are blind. My husband has no sight. He's one of the 4%, as he keeps telling me. special. And the first question they ask us is, do you have a carer? Do you have someone sighted? Because we all have a sighted person. This is going to be apparent. We all have a sighted person we keep in the cupboard to read stuff, to do stuff, to write stuff. I mean, if I had £1 for every single time, is there someone sighted that can help you with that? I'd be so rich. You know, we had the usual conversations around kind of history, you know, just usual booking in, but we spend an awful lot of time on eye conditions. My eye condition is not genetic. Let's move on. My husband's eye condition is not genetic. Let's move on. No, we could not move on at all. Who was going to support us? Who was going to help us? Who was going to be there? Is there anyone that can help if something goes wrong? What is our support system? Are these questions you are asking a sighted person? Let's think about that just for a second. Because if the answer is no, then I should never have been asked them. Anyway, I was a first-time mum, so I didn't know this wasn't normal. And then they asked me back for another appointment, and I saw a different midwife, and we spent 15 minutes talking about eye conditions. I think I was 12 weeks. So it was my 12-week scan, and it was, I had a midwife appointment at the 12-week scan as well. I think it probably was for bloods or something like that. And I came home and I just felt awful. I felt like, is this what the next however many weeks is going to be like, constantly talking about my eye condition that has nothing to do with my baby? So I had a chat with my husband. I sound quite angry, I'm not really. And we decided that we wanted this experience of parenthood to be positive. And so we were very lucky that we could instruct an independent midwife because, and that was the second thing. I wanted to have my baby at home. I wanted a home birth. And for some reason, and a reason that never ever became apparent, I never worked this out. I couldn't have a baby at home because I was blind. I mean, does the birth canal open better in the hospital? I'm not sure about that one. Anyway, I was very lucky to get an independent midwife called Virginia Howes. And I called her up and I said, look, I just wanted to get this out of the way, get the elephant in the room out of the way. I'm blind. She went, well, I'm sure the baby's going to come out the same way, isn't it? And that was it. I knew that she was the lady, and she empowered me a huge, she taught me about my body. But we unfortunately we did have a transfer to hospital, and it was a bit difficult. And we experienced the same discrimination when we transferred to hospital, where my husband was physically was tried to be stopped coming into the room where I was on all fours on a hospital trolley pushing, because I'd been pushing in the ambulance. And they said, oh, you wait out here while we sort it out. And he was like, my wife's going in there. You aren't stopping me going anywhere without my wife. When Virginia, at 32 weeks, called up the health visiting team and said, I'm looking after a blind couple. First thing they said to her, oh my goodness, have you thought about safeguarding? And she was like, what? They're a blind couple. We need to think about safeguarding the baby. The health visiting team insisted on having and I forget what it's called, a CAF, yeah, thank you. where wanted social service to be involved. This was horrifically stressful. So now I was in a tailspin as a first-time mum. They are going to think I can't look after my baby and they're going to take it away from me. And and to this day, that is a real concern for me, not because I'm being dramatic, but because somebody somewhere can make a judgment, Becky, jump in if you don't think, that I am, and my husband as blind people looking after children are not capable. I mean, I have two very active children. My son is a footballer and my daughter is in a gymnastics competition squad. And every single time they hurt themselves and I have to take them to A&E, which happens quite often, I am terrified that someone's going to say, is this because you couldn't see? Mm-hmm. And that is a very real fear. So I started within the health visiting team from a place of mistrust. I started with health professionals who are supposed to look after me and give me support. I do not trust them. And you know, my health visitor, and I told her when she arrived, I don't trust you. I don't trust you. I don't understand why you're here. You guys don't think I'm capable of. And what happened to me was I had crippling postnatal depression with my son. And I didn't tell anyone. Because why did I tell anyone? Because I thought they were going to blame me not being able to see and take my baby away, because that was the message that had been given to me. I was not capable. I'm lucky, me and my husband are lucky that we both work, and I got some private support because I wanted to stay out of the system. And how terrifying, from a safeguarding point of view, from a looking after a woman point of view, how terrifying is that? As a medical professional, if I heard that, I'd be absolutely mortified. Lots of people, so I struggled to breastfeed, and the message I had, which is fundamentally not true, is you can't breastfeed because your son can't see you and you can't see him. I mean, I don't know. Why my son couldn't we weren't successful was because my son had torticollis. And I had to push because I recognized that there was something wrong with his neck, because I was constantly had my hands on him, constantly touching him, constantly feeling him. You know, my children have been raised through touch, so they are ridiculoely tactile, constantly looking for like cuddles and things, which is really annoying. But you know, and I had to push because they didn't believe me. I was like, but he's not tracking. How do you know he's not tracking? Because you can't see him. No, but if he's tracking, he has to move his head, and that's not normal. I can't see, but I know what's normal. But, fast forward 2 years, and I started to become a recurrent miscarrier, unfortunately. Had 4 miscarriages in total, which frankly are horrific. They're horrific for anybody. It's a horrible. But I had an ectopic pregnancy that unfortunately ruptured. And I remember I went in and I said, I'm in lots of pain. And they said, oh, it can't be that bad. You're not, screaming, yeah, yelling. No, because I have all of my children I've had with no pain relief, and I just deal with pain in a different way. I'm insular. I go into myself, and I told them this. I told them that that's how I behave. I told them this. Eventually, I was like, they put me in a side room because we had guide dogs, and what if people are scared of the dogs? So I was kneeling on the floor with my head, if you can imagine, with my head on a chair, and like just saying to my husband, I just want you to stab him. I just want to kill me. I'm in so much pain, and I just want you to kill me. And a doctor that dealt with us, this was my 3rd loss, and the doctor that dealt with us before came in, and she was like, what are you doing? I was like, I'm in so much pain, Naomi, I can't cope. She's like, I need to get you in for another scan. Turned out the ectopic had actually ruptured, and so it was all a bit ER-y, a bit scary. They didn't have George Clooney though. And rushed into hospital, rushed into surgery at sort of 10 o'clock at night, came out, and the next day I'm assuming he would have been the surgeon that carried out, I'm not sure, whoever, because I was still half asleep. He said, oh no, it's all sorted. And maybe this is a positive outcome considering your situation. Oh, it's funny. It's funny now because looking back, because I just think, oh my goodness, like how many other women have you spoken to like this in the worst time of their lives? These were all very much wanted babies. Anyway, I was going to have a 4th miscarriage, and then I got pregnant with my daughter. And yes, I was anxious after having 4 losses. I was absolutely, I was convincing myself this baby wouldn't stick around. she's tough, and she did. But what happened to me then was I had hyperemesis, and I wouldn't wish that on my worst. I was being sick 50, 60 times a day, and no one would believe me. Eventually I was admitted to hospital when my husband came home from work, and I didn't know who he was. I was like, I don't know who you are. Like, go away. Don't like. And he was like, this is not normal. And I was severely dehydrated and put on some type of medication, but I'm allergic to quite a lot of the frontline antiemetics. So, and I kept getting this, maybe think about trying to reduce your medication. And that's done. Oh, sorry. And that's something that is, a constant. I had my daughter Nikita at home, really quick labor, 1 hour and 20 minutes, thank you. And I know that there's no problem with breastfeeding as a blind person, because she came on, I had her in a pool in my living room, and she came out, was like, give me the boobs. And that was it for 2 years. It was like, no bottles, that was it. And it wasn't because I was better at it or I knew what I was doing. She knew what she was doing, and it had nothing to do with blindness. And, we then had Mia, who was a very much of a surprise. And a pandemic baby. Again, I had her at home. I've got one of them. They're the best kind. But I guess the takeaway from my experience, again, I had hyperemesis with her as well. I was disbelieved, disregarded, disrespected, and treated and infantilized. So there's a lot of things that I could never access. I've never been able to access my children's read books. I've never been sent any information in a format that I can read. Or we can give you something in a large print. You can make it as large as you like. I'm not going to see it. The idea that that you don't have a sighted partner is horrifying to a lot of people. The idea that 2 blind people are having children, raising them successfully, but also the reality that 2 blind people own their own home and work. And on that point, I do want to say, we talk about outcomes for, outcomes for women who are in deprived situations, perhaps on the poverty line. 75% of visually impaired people of working age cannot get a job. Not because they don't want one, because they can't get one. So there's no stats. We can't find the stats, but if you think, so a lot of women are raising their children as blind women, perhaps on benefits, perhaps struggling to feed their children. And there is a disability tax. Being disabled is expensive. Getting to antenatal appointments, you have to get taxis. Hospitals are confusing. If you've never been to one and you can't see, there's no support. No one asks you, can we meet you at the doors? There's no joined up support. And I'm sure actually, Beck, some of the things that happened to me that are really important to note. Dinner rounds and breakfast rounds were missed because I couldn't find my way to where someone just rang a bell and said it was dinner, and no one just showed me where it was. So I missed it. And then I was berated for not having something to eat. Well, I couldn't get there. So it's remembering that it's about the patient. It's about the woman that you're looking after. I asked to have a sign on my door to say, because I had a private room and I was being sick so much, please, this person is visually impaired. Please introduce yourself when you come in. They wouldn't let me do that. And their reasons were, oh, it's a confidentiality issue. What? I mean, I really would like to understand that, because I don't. And so random people would just walk into my room when I was being sick, never talk to me, never introduce themselves, perhaps do something with a bin and go away. Had no idea who these people were. They could have been robbed from the sweet shop downstairs. I don't know. So let's just be a bit sensible, because a lot of these things can be avoided, can't they?
Totally. So I just wanted to add really quickly, because I'm conscious of time, that me being a social worker came out of the fact of how I was treated as a blind parent, first-time parent. I was 21, I was young, I was in a difficult relationship, and I had my first baby over in Yorkshire. When I was in hospital, they told me I couldn't, and I emphasised the word couldn't, leave until we'd had a safeguarding meeting. Now, as a social worker, I would now be the worst person to tell that to. I would ask them under what legislation. I would ask them under which section of said legislation. And I would be a nightmare. But back then I was 21. I didn't have a clue. And the reason they wanted the safeguarding meeting was because I couldn't see and my then partner couldn't see. They never asked me about any of the issues that were potentially raised about our relationship that was quite controlling and coercive. No. All their emphasis was on, how are you going to raise a baby when you can't see? And now I am exactly the same as Het, in that every time a health professional visits me, God, I clean that house till it's...
Yep. And the kids have new clothes on because I don't know if they're stained.
Yeah. And that this is the issue. We spend our lives proving ourselves. You know, all this about proving yourself as a mum, and every mum feels that, and I'm sure every mum does. They are here, and then we are here, because we always have to prove ourselves that little bit more, because society expects us to fail. Right, next slide, please. So this is just a little bit about how we feel things can improve. So we didn't want to be
running out of a bit of time.
Go on,
so
we're just
sorry.
we're just going to do it properly quick, and then we can skim over it, and then people can just have a look, and
ask us some questions. We're going to be sticking around, so come in.
Yeah. So if you go to the next one, then people can have a look. So these are just some of the ways that we feel things can be improved. So ask us, respect us, listen to us is basically the key things from what we're saying.
Thank you.
Thank you for
so
having us.
enlightening. Thank you.